another dear friend from another part of Asia, my esteemed colleague, Dr.Dorai. Raju. Dato is the distinguished Malay title, which is the equivalent of what we would call a knighthood or a Padma Bhushan. Dr. Dorai Raju is the first traditional physician, as an Ayurvedic physician, in Malaysia to be awarded this honor of Dato. And he is a leader of Ayurveda and natural medicine in Malaysia, and is, as I'm sure Dr. Narendra will tell you, the president of the umbrella body of traditional medicine associations of Malaysia. Dato Dr. Dorai Raja.
Thank you, Dr. Bodekar. Dr. Dorai Raja was formally trained and got his MD in Germany, and he got his other degree in professional Ayurvedic training at Banaras in India. He did his BSc in acupuncture from China, so he has a training background which encompasses Western medicine, Ayurveda, as well as acupuncture, and he chooses to practice Ayurveda in Malaysia at 2 places in Malaysia, and he is president of the umbrella body of traditional medicine in Malaysia, which comprises of the Malay, the Chinese, the Indian, and complementary medicines. He is president of the Malaysian Association of Traditional Indian Medicine and is advisor to the Scientific Research Center in Singapore and the State Biotechnology on Nutraceuticals. He is also the state advisor to the Chief Minister on Traditional Medicine, as well as the Chief Physician to the Chief Minister of Penang, Malaysia. He has been a member of the Evaluation Committee for Standard and Criteria on Traditional and Complementary Medicine, and is a member of the Standing Committee of Traditional Systems of Medicine in the Ministry of Health in Malaysia. He was awarded recently the state highest award for his contribution in the field of healthcare and conservation, and is awarded the Justice of Peace by the federal government of Malaysia. I welcome Dr. Dorai Raja.
Namaste. Honorable Chairperson, dignitaries, my colleagues, ladies and gentlemen, a very good afternoon to you. First, I would like to mention that I usually like to stay within the time because we've been given 15 minutes, and I don't want to step on the next speaker's time. So I will straight away take you on a journey of what's happening in Malaysia. I'll finish what I'm saying, then I will conclude the whole issue. So ladies and gentlemen, bear with me. Ayurvedic services, there are approximately 20 Ayurvedic clinics and centers in Malaysia. Staffing is mixed with some local personnel and some Ayurvedic doctors trained in India. There is just one professional body, the Malaysian Association of Traditional Indian Medicine, so that actually makes it easy, that there is no contest. Education and training. There are no educational institutions, although development in this direction is sought by the association and private sector interests. So you know, for all these many years, personnels trained in India in Ayurvedic medicine have been actually struggling on their own for this number of years without the assistance of governmental help or assistance from India in other ways. Ayurvedic products. Ayurvedic products are mostly imported from India. There are no local manufacturer. The Malaysian Ministry of Health has a drug control agency which sets standards for the content of heavy metals and prohibited herbs. The DCA also requires testing for E. coli and other bacterial and viral contamination. DCA does test on samples supplied by the Ayurvedic clinics or importers. Once the criteria is complied, medicines are then allowed for import Now, let me just say that the Malaysian Ministry of Health is actually more difficult than the one in Britain. Even though it was the British government that set the whole ministerial aspect of health care in Malaysia, but Malaysia has more a stringent aspect of practice of medicine in Malaysia. So that makes it more difficult for actually complementary medicine to actually establish themselves in Malaysia. A problem is the lack of understanding by DCA of the principle of Ayurvedic medicines, having multiple therapeutic ingredients. Instead, DCA is looking for single markers in medicines. I think this is one of the main issues all over the world. DCA's selection for its list of banned substances is primarily guided by international decisions such as those of the EU and the US FDA. Now, the legal and regulatory issues. Ayurvedic profession is currently waiting for Malaysia's Act on Traditional and Complementary Medicine, CAM Act, to come out with specific guidelines for practice. Now, I would say this is a great achievement. Great achievement in a sense that if a government is coming out with such legal and regulatory issues pertaining to the practice of complementary medicine, that means there is an endorsement and acknowledgement in that country that the people of that country are using traditional medicine at a greater advantage. The association disseminates policy information to all the practitioners, and the association's constitution spells out terms and conditions for professional practice and code of ethics. Now, while the government is in the wake of coming out with its act, the association, which registers all the practitioners and oversee their practices in the country, is in accordance, or they comply to the code of ethics and practice, because this is safety. Now, in any system of medicine, safety for the public is of the utmost interest. Research. Malaysia is seeking research collaboration with India on research into Ayurveda. Some research is being conducted at the university and national institute level on individual herbs used in Ayurveda, such as Centella asiatica and Phyllanthus amarus. However, there is no systematic clinical evaluation of Ayurvedic complex mixtures for the prevention and management of disease. One private sector study is examining an Ayurvedic complex formula for skin disease and is being done in partnership with researchers from Oxford and the University of London. Now, contacts with India. This is occasional but not coordinated or systematic for the national development of Ayurveda. However, the association is currently working to set up a partnership, a framework for formal partnership with India in this regard. The association has links with 2 Ayurvedic universities in India. Individual companies and clinics have their own organizational links, propagation and usage. And here I would like to share with you that 75% of my patients in my clinic are Chinese, and they do use Ayurvedic medicine as a first line of treatment for their health needs. And this is a major breakthrough. Now, it is evident that India needs to offer its professional support in terms of collaboration to upgrade the professional standards in other countries. Now, we out there, we have been doing things individually or collectively among the physicians who are trained in Ayurveda and who have grouped themselves to struggle and bring this message to the government, the health ministry of the various countries. Now, we are just children of India, who is the mother of Ayurveda. And definitely India has to look at the children who are either crying or begging for help. And it is my utmost humble request from personals who are educationists or who are policymakers that you take this point as an evident point and start working towards as how India can help the other practitioners and associations who are struggling to establish Ayurveda in a greater aspect. And also to assist all the practicing Ayurvedic physicians in other countries to procure the medications and make the drug control authority of related countries understand the foundational principles in the art of manufacture of medicine in Ayurveda. Because as you know, most countries with their own agency, drug control agency or drug control authority, are not trained or addressed in the field of Ayurveda. And sometimes no amount of our explanation are taken into deeper consideration because they are considered scientists and pharmacists who do not understand the underlying fundamental and foundational principles of the Ayurvedic science and its manufacture of medicine. So this is again where India has to make the authority of other countries in the Department of Pharmacy to understand how Ayurveda functions in terms of medicine. And most of all, India should be working for a first-hand collaboration with the World Health Organization to help standardize and draw up a standard criteria for an Ayurvedic syllabus globally. Now, ladies and gentlemen, after many years of struggle, the Malaysian scenario or the Malaysian government has come to accept complementary medicine because of the global transformation or global paradigm shift. And there is no way anyone can stop this flow, or otherwise that country will be left behind in the coordination of integration or integrative medicine. And this is a great plus point for holistic medicine because the government has understood the message of the general public and that such a system is there to help them or to bring well-being to their disease state. And in that aspect, we in Malaysia have come to that stage of bringing the syllabus of Ayurveda to be endorsed officially and to be accepted. But we are short of just that half an inch because we need the assistance of India to offer that syllabus. And you know that WHO has a collaborative functions with government and health ministries all over the world. And when a system is endorsed and accepted by WHO, then it's accepted by ministries, health ministries of other countries. Now, as Professor Bodekar in his speech and his slides, where he had shown the differences between Chinese and Ayurvedic medicine, it is a cry within you. Because, let me just quickly tell you a little bit history, because I think history is part of also education. Now, even though Ayurveda has been professed to be of more than 5,000 years old in practice in India, now I found out in my travels that Ayurveda has also had a dominance over Southeast Asian countries for more than 1,200 years. In countries like Burma, Thailand, Cambodia, Indochina, Malaysia, Indonesia, during the dominance of the Kalinga Empire, Srivijaya Empire, and all these empires that has great influence over all these countries and had established Ayurvedic treatment as the main healthcare system of assistance to all these countries more than 1,200 years. So the theme of globalization of Ayurveda globally should be re-globalization of Ayurveda globally. So ladies and gentlemen, with that, I would like to not dwell too much, so I don't want to take up the time of the next speaker, but I think I brought my point here that India need to play a bigger role, fast and quick, and like the great Dr. Mashelka had mentioned in his inauguration speech, that the Prime Minister of India, in his 1-hour personal meeting, he personally told me that for more than half an hour, the Prime Minister has stressed on traditional medicine. Prime Minister of Malaysia, my Prime Minister, had stressed for more than 20 minutes on traditional medicine and Ayurveda. And for your information, the Prime Minister's wife was treated with Ayurvedic medicine, and great eminent politicians and policymakers of Malaysia use Ayurvedic medicine. And with Dr. Mashelka's visit to Malaysia and with his collaboration, I'm sure he will take a leap and endorse that the government of India, or at least request that they offer the required assistance to all my colleagues here and to all the other countries. And before I leave this stage, ladies and gentlemen, I put the namaste, terima kasih, thank you, and sia. This is because the Malay, Chinese, and the Indians and other races use Ayurveda in a greater aspect in Malaysia, and that is an endorsement. And before I leave this stage, I would like to mention a few words about my colleague, Professor Bodekar, who silently and humbly and profoundly over the years has done a lot of work on Ayurvedic medicine because of his love towards Ayurveda. He's a man of great knowledge, great understanding, and has very great and good networking globally. And as my friend, the eminent Vaidya Raju has mentioned, that he knows who and where globally. And ladies and gentlemen, I kindly request the audience to join hand with me, because it would be a dishonor if I walk away by not honoring this great gentleman. Please join hands with me to give him a great applause. Thank you.
Thank you very much, Dr. Dorai Raja. Part of your brief was not to embarrass me. Thank you for your very kind words. And I think what we hear from Dr. Dorai Raja's presentation, most compellingly, he was calling on Mother India to respond to the cries of her children around the world. I think that's a very heartfelt expression of the need of the time. Also, he again emphasized the importance of these themes of training, a standardized universal syllabus as a frame of reference for countries, and assistance from India in ensuring that drug control agencies in countries really understand what constitutes Ayurvedic technology and pharmacopoeia and combination principles in preparation and not use standards developed from countries that don't understand these principles. I think also, finally, he made a very interesting and indeed revelatory point that many of the, what we call now traditional health systems of Southeast Asia, actually are prehensile forms, if you would, or have their roots in a much earlier wave of Ayurveda going back 1,500 years from the earlier Vedic empires in that region, and that in a sense these constitute, if you would, an Ayurvedic diaspora waiting to be recovered and reawakened, and that certainly is my experience in many of these countries who themselves acknowledge these origins. That is an opportunity for Ayurveda to really bring this knowledge back up to its fore in the countries and regions where it previously existed.